If I say that nearly half of the women on the planet are at a risk of developing mental health disorder, would you bring the issue to light or just evade the issue? Surprisingly, this isn't a fictitious statistic, but a reality we face. It is a serious thing and demands that we look beyond the all too common jokes about women and men. Traditionally, mental health has been defined as a lack of symptom distress, as in lack of depression or anxiety. But of late, it also comprises some positive qualities that an individual should possess in order to be mentally stable. It includes cognitive fitness, emotional well-being, and being psychological sound. While cognitive fitness means how well the brain functions, as in memory, learning, concentration, the emotional well-being is the acceptance of oneself and being comfortable with who you are and being able to experience your emotions in a positive way. The psychological well-being refers to adapting to and responding to the various life challenges without being overwhelmed. WHO defines mental health as a state of well-being where each one realizes his or her potential, copes with the normal stresses of life, can work productively, and can contribute to the community. In the world, 1 in 4 people, that means almost 450 million people, are suffering from mental health disorder. And women are double at the risk than men. What about India? In India, we have almost 13.7% of the population which is suffering from mental health, and it is estimated to be almost 20% by 2020. And this is just an underrated statistics that we have. In fact, WHO has dubbed India as the most depressed country, having 57 million people suffering, and the second most anxious country, having 38 million people suffering. 1 out of every 12 men and 1 out of every 5 women suffer from mental health disorders. Of all the social determinants, the gender is the most powerful one. It's been found that the anatomical and the functional differences between the men and women's brain dictate the susceptibility to mental health. Early life experiences play a role whether the individual will form mental health disorder later in life. The various issues which are salient to women's health are trauma, violence, abuse, whether physical or sexual, the biological factors, the developmental, legal, and the health system issues. Unfortunately, there's still a stigma associated with mental health, and the reproach is not only for the patient but for the family as well, and the disgrace is doubled if it is the woman who's suffering. For a long time, estrogen has been blamed for all the problems a woman suffers, although it is not yet proven. On the other hand, it was found that the estrogen, the normal value, it was not the exact value, but the differences in the difference in the values during the menstrual cycle was what was causing the problem. In fact, it is the roller coaster of the values of the hormones during the reproductive cycle which causes havoc in the women's life. On the other hand, a recent study stated that women's hormones have an hidden intelligence, and estrogen was termed as the Iron Lady of hormones, which was the fuel for the feminine engine. There are various issues which a lady undergoes during her life cycle. At puberty, almost 30% of the young damsels have symptoms like anxiety, depression, lack of concentration, lack of sleep. The various risk factors being the peer pressure, the academic performances, the physical appearance, obesity, the love affairs, teenage pregnancy, etc., etc. Almost 20 to 40% of women suffer from various mental disorders prior to menses. And this is extremes in almost 3 to 9% of the women. Again, the risk factors being economic independence or economic instability, the work pressures, the dual pressures, the separated relationships, etc. Around 10% of the women develop a serious form of premenstrual syndrome, which is premenstrual dysphoric disorder. 1 in 3 females consuming birth control pills have found to have depression. On the other hand, the women who are not able to conceive, the anxiety associated with it, and also the effect of these strong fertility-inducing medicines cause havoc in their lives. Various medicines have depression as their side effects. Hormonally speaking, there is no doubt that pregnancy is the most volatile time in the life of a woman. Almost 20% of the ladies, in fact, I would say this is underrated again, suffer from mental disorders during pregnancy, be it anxiety, be it depression. Post-pregnancy, 50 to 70% of the ladies have postpartum blues with symptoms of depression, anxiety, excessive crying spells, not able to concentrate, sleep disorders, etc. 20 to 30% develop severe postpartum depression with violent outbursts and also sometimes suicidal tendencies. Again, the risk factors being the adverse outcome of the pregnancy, the experiences during pregnancy, undesired sex of the child, single mothers, lack of social or family support, etc. It was found that most of the women prior to menopause were not afraid of breast cancer or night sweats or osteoporosis, but of losing their mind. Almost 1 in 10% of the 10 women suffer from depression. This continues postmenopausal, although postmenopausal the rates are similar to the male counterparts. So what are the factors which affects? Is it only hormonal or there are other factors? It was found that women are now working outside homes due to their financial needs or financial independence. But the domestic chores and the domestic responsibilities are not taken away from them. In fact, the stressors of life like pregnancy, the maternal role, or taking care of the children or the old or the sick at home is purely the work of a woman. The women also suffer from lack of independence in the education or the occupation. There are no clear-cut policies in India to look after the severely ill women. In fact, there are various violences against Indian women, which includes the dowry harassment, domestic violence, female feticide, sexual trafficking, etc. There are various setbacks when we come to mental health problems. Most of the time, the women do not themselves understand that they need help, as it is considered a sign of weakness. For those who do decide to come for help, there is another problem. In a country of 1.3 billion, we have only 5,000 psychiatrists, around 1,000 of clinical psychologists, and 1,500 psychiatric nurses. So how do we prevent it? As physical fitness for mental health, similarly taking care of our brains for mental health. Learning to understand how and why these risk factors affect our women and what can be done about it is a good way to start understanding the problem. The first-line therapy need not be the medication or the psychological therapies. A simple first-line treatment can be our lifestyle modification. A high-energy, nutrient-dense diet is a good way to begin understanding, taking care of the mental well-being. Exercise in any form, even if it means a brisk walking, is good for all our women. Simple meditation and prayers do help them in many ways. Stopping smoking, substance abuse, or alcohol or any other problem drinking is our obvious health recommendation. Sleep hygiene, it needs to be learned and taught, including the less exposure to blue light, especially the lights emitted by our laptops and our cell phones. An important advice to be given to these ladies must be rest, relaxation and leisure time. A walk in the sunshine enhances vitamin D as well as the mood stabilizing hormones serotonin, which are both required for mental health. Extension of spending the time with the flora is the effect that the animals have on our life. The women are not designed to be superwomen. They can act as women, and a self-care is supposed to be in their to-do list also. They should be taught that it is not a weakness to ask for help if required. It is okay not to be okay, and they can ask you even if you are not a psychologist. There are various organizations which have now come forward for these women. MCI also, after so many years, has included mental health as a part of curriculum, which will be starting next year. So what is our role as clinician? What can we do about it? We know that the mental health policy bill, which was passed in the Rajya Sabha, promises access to all to mental health by 2020. And India is woefully ill-equipped to come to that promise with the handful of psychologists and the psychiatrists that we have. So it demands an all-hands-on-deck approach. We need to understand the effect the hormones have on the life of a woman. I believe if each girl and each woman is taught about the menstrual cycle, the hormonal effect, they will be benefited. They should be taught about the potential nudges they have on the life of the emotional life of a woman, so that they can use it for their pleasure, or they can avoid it to avoid the perils in their relationships. It will help not only them, but also their families. We should inculcate the feeling of well-being in the women as a whole. And it begins with us as advocates to transform the healthcare system, our schools, our workplaces, everywhere that we go. We need to ask these women who come to us, in the first instance, we need to be aware about these mental health problems which affect the women. We need to ask them every time they come to us. Believe me, it will require one extra question, one extra minute to ask about their mental, their psychological well-being. We need to encourage them and give them the lifestyle modification and the advice required. The community needs to be taught about these mental health and the various help available for them. A woman's health must include mental health as well, physical health as well as mental health, along all the life cycle transitions, and not just the reproductive and maternal care, which is often the only perspective of the policies of our healthcare system. It should involve holistic care. If the women comes to us, they can come to us with their only history. But history or her story is more than what she just says. But are we listening? Thank you all for listening. This is a motivational talk, and I would request each one of you to start mental health, psychological health questions or simple asking about them in our day-to-day practice. Thank you.